that we are committed to finding at least $1.5 trillion in savings for the American people, while also preserving our essential programs. The Democrats are out right now trying to make hay out of the fact that we're going to gut Medicaid and all these other things. It's simply not true. We're going to protect the essential programs for everybody who's eligible to receive those.
We have been working hard, trying to keep up with the president. The reconciliation package, of course, is a big part of that. And that will be the vehicle where we deliver most of the America First agenda. So a lot of work's gone into this. We've been working on that package for over a year in anticipation of this moment, because we knew he was going to win another term and that we would have unified government with Republicans in charge of the White House, the Senate, and the House. We cannot waste this opportunity.
Senator Josh Hawley is causing some big problems for Mike Johnson and Donald Trump's big, beautiful bill.
Hi, now from Capitol Hill, Senator Hawley, thank you so much for being with me this afternoon. So as we just showed you, you were warning your party not to cut Medicaid. The speaker, though, he just said this about the House GOP's so-called big, beautiful bill. Listen.
Will you cut Medicaid?
We're not cutting Medicaid. Stop buying that.
So he said, if you heard there, Senator Hawley said, we are not cutting Medicaid. Do you agree with the speaker? Is this bill not a cut to Medicaid?
Well, the right thing to do is not to cut Medicaid, so I'm glad to hear him say that. Manu, it ought to be just a basic foundational principle. It is wrong to cut health care for the working poor. And that's what we're talking about here with Medicaid. My state is a Medicaid expansion state. Over 20% of Missourians, including hundreds of thousands of children, are on Medicaid. And Manu, they're not on Medicaid because they want to be. They're on Medicaid because they cannot afford health insurance in the private market. These are working people and their children who need health care. And it's just wrong to go and cut their health care when they're trying to make ends meet, trying to help their kids, trying to make sure that they're able to provide for their families. So I hope that the House GOP and the Senate GOP will get the message here. By the way, President Trump has said the same thing. No Medicaid benefit cuts. Number one, I don't want to see any more rural hospitals in Missouri or anywhere else in America go out of business. We've lost too many of them in the state of Missouri, Manu. I don't like the idea of decreasing funding for rural hospitals. I'm worried that the House bill goes way too far in that regard. I also don't like what is basically a hidden tax on working poor people who are trying to get health care. I mean, this whole idea of we're going to charge them now additional co-pays in order to access health care, I have to say that just sounds like a tax to me. So now we're taxing poor people when they're trying to get access to health care? I've got big concerns about that.
So if this bill comes over from the House to the Senate and you have to vote on it, are you no if this bill does not change?
Yo, I'm not going to support this bill from the House in this form. I think that's clear. It's got to change before it can pass the Senate. And I continue to stand by my line in the sand, which is no Medicaid benefit cuts.
Josh Hawley has called Trump's big, beautiful bill morally wrong and politically suicidal. And let's be clear, he's right about those things. But let's be equally clear that this isn't fundamentally about principle. He's a weasel. He always has been. He sees the writing on the walls. He's not fundamentally protecting his constituents. He's protecting himself. They just might be caught in the protecting crossfire. Republicans are starting to realize, it seems, that their blind loyalty to Donald Trump is not going to be enough to keep them in their seats this time around, not with how wildly unpopular Donald Trump and his policies are. The midterms are coming, and it's all about to hit the fan.
In terms of getting the approval ratings up or people having more faith in them, I do think that the showdown over the reconciliation bill is going to be a major positive point for the Democratic Party. And the Republicans are out there saying, we're not cutting Medicaid, we're not cutting Medicaid. But when you ask the Energy and Commerce Committee to cut $880 billion, there's no way to do that without going through the Medicaid problem. And that is why David Valadao in California, just today, Bernie Moreno, the senator from Ohio, you have Josh Hawley, Susan Collins, are all saying that they can't support this bill the way that it's constructed because you have Medicaid cuts. There were 37 patient groups, American Cancer Society, Leukemia Society, Diabetes Society, who come out against the bill as well, saying that this is going to end up forcing patients and families out of the program. In 2017, Democrats were able to get it together, a la your book, because the Republicans out of the gate went after Obamacare. People do not stand for you coming for their health care. And if Republicans carry down on this path and they go with the reconciliation bill as it is, the big, beautiful bill, the midterms should, and historical precedent would indicate this, go very well for the Democrats. Does that mean that 2028 is ours? Absolutely not. But it does mean that we'll have a very good showing.
And many of the ways that they are designing these changes to Medicaid are based on changes in Georgia. Georgia has the third highest number of uninsured Americans in the country. Catastrophic. And that's with the so-called improvements from monthly reporting paperwork requirements to annual paperwork requirements. And so the Republican majority has looked at the state with the third highest number of uninsured Americans and said, that's what we want to model our Medicaid system after. This catastrophic failure. And I understand that the Republican majority wants the American public to be sold into accepting this by saying, you know what? We are secretly paying for Medicaid for every Venezuelan in the world, and that there are millions of 8-year-olds getting sex reassignment surgeries on Medicaid dime, and if we just take all of that, that will somehow make your Medicaid, cut that and make your Medicaid better. Sounds ridiculous because it is. And then they want to say, if you have $1 million house, right? Let's set this cap at $1 million. Okay, cool. I have a question though. I have another number that I think is interesting. Maybe what if you're getting a $22 million house, inheriting a $22 million house? Because what Republicans are saying is that if we make all of these cuts, we will then shift that and invest it into Medicaid for people who actually deserve it. But if that were true, then the top line number, our budget for Medicaid, would be staying the same, right? We'd be taking from undeserving people and giving it to deserving people, and that should even out. But that's not what's happening in this bill. This bill is cutting nearly $1 trillion in Medicaid spending overall. Why? Because down the hallway, they are trying to finance tax cuts for people who are inheriting $22 million houses. Because in 2017, Republicans and the Trump administration tried to increase the exemption of what you get a tax break on. If you used to inherit an $11 million house, you would get no taxes. You had no taxes on that in that estate tax. They said that's not enough. We need no taxes on a $22 million house.
Will the gentlelady yield?
Expired. I have to finish. That expires now. And it costs a lot of money to extend that tax break up to $22 million. So to pay for that, they are doing this. They are modeling and completely retrofitting the United States Medicaid system to model it after the state with the third most catastrophic uninsured American number in the country. In the dead of night at 2:38 in the morning.
The cuts being proposed are wildly unpopular, and GOP politicians are finally getting spooked by that. That's why you're seeing this sudden flurry of concern and pushback against Donald Trump. They want to be seen to be standing up, even if it's half-hearted, so that later they can say, see, I tried, I was one of the brave ones. But they're not pushing back because it's the right thing to do. They're doing it because they know they're going to get burned if they don't. Far-right figures like Hawley, Marjorie Greene, Steve Bannon, Laura Loomer, even Trump himself will occasionally say something that sounds surprisingly reasonable. It's just enough to give them plausible deniability or to generate a good headline or two. They'll drop a line that sounds moderate or bipartisan, something that could resonate with people across the aisle. But don't be fooled. Watch what they do, not just what they say. Pay attention to how they actually vote. At the end of the day, this isn't about serving the people. It's about survival, power, and narrative control. But voters are catching on, and as reality starts to hit more and more people, the ones who enabled it won't be able to hide behind sound bites. Hopefully, they won't be able to hide behind a few vapid, shallow headlines either. The media has a responsibility to call these people out whenever we get the chance, and we get a lot of chances. Just because they can play nice occasionally and can say all the right things, that doesn't change the fact that they're doing untold harm to their constituents, and more importantly, to our democracy.